Hey there, expecting mamas! As you approach your due date, you might be hearing all sorts of tips and tricks for getting labor started. One of the most talked about methods is using castor oil, but does it actually work? And more importantly, is it safe? Let's dive into the facts. So, what's the theory? Castor oil is a powerful laxative. The idea is that by stimulating the bowels, it can also cause the uterine muscles to contract, potentially kick-starting labor. This is because the muscles in your bowels and uterus are close neighbors, and intense activity in one can sometimes trigger activity in the other. Now, for the big question, is it effective? The research is honestly a bit mixed. Some studies suggest that taking castor oil might increase the likelihood of going into labor within 24 hours, but only if your body is already showing signs of readiness, like a cervix that has started to soften and dilate. For many, it might not do anything to start labor at all. It's definitely not a guaranteed magic button. If you're considering it, it's crucial to know how it's typically used. But please remember, this is not medical advice. The common method involves taking a small dose, often around 1 to 2 tablespoons, sometimes mixed with juice to mask the taste. However, there isn't a universally agreed upon safe dose, which brings us to the most important part: the cautions and side effects. This is where you really need to be careful. The most common side effects are pretty unpleasant: intense diarrhea, stomach cramps, nausea, and vomiting. These can lead to dehydration, which is not something you want to deal with when you're about to go into labor. There's also a concern, though debated, that it could cause the baby to pass their first stool, called meconium, while still in the womb, which can lead to complications after birth. The bottom line is this: you should never, ever try to induce labor with castor oil without talking to your doctor or midwife first. They know your specific health situation and can give you the safest advice for you and your baby. Your healthcare provider is your best resource for discussing all labor induction options. Their goal is the same as yours: a healthy mom and a healthy baby. Thanks for watching, and I wish you all a safe and happy delivery. If you found this helpful, please give it a like and subscribe for more pregnancy insights.